My name is Yasmin Silva. This is my student ID. I'm going to start off by providing patient privacy with the curtains. Hygiene. Hi, my name is Yasmin Silva. I'm your student nurse today, and I'm here to do your head-to-toe assessment. Is that okay?
Yep, that's perfect.
Okay, so just so we can start off, I just need you to confirm your full name and your date of birth, please.
Yep. Valentina Escobar, December 21st, 2000.
Perfect, thank you. Now I'm going to start my general assessment of the patient. Patient seems to be well rested. Her physical appearance, she seems well kept with her personal hygiene. There's no foul odor present. She seems to be in a good mood. When I ask her questions, she's able to respond them with no slurring of her speech. Can you stand for me?
Mm-hmm.
Perfect, and just sit down. Patient looks like she is the right age that was given, and her height is consistent with her age as well. Her skin color is consistent with her ethnical background, and there's no redness or unusual discoloration. Patient's weight seems to be consistent with her build as well. Okay, one more time, can you just give me your name, where we are, and roughly what time it is?
Yeah, so my name is Valentina Escobar. We're at the hospital, and it is 2:19.
Okay, perfect. With this, the patient is alert ×3, and her mood seems well. She's relaxed and at ease. So now we're going to start with the head assessment. So upon looking at the patient's face, her head structure is normal cephalic in size. There is no unusual lesions, scars, masses present around her face. All of her features seem to be symmetrical. Now I'm going to start testing for cranial nerve number 7, which is the facial nerve. Can you close your eyes for me? I'm going to try to apply resistance. You're just going to try to open them. Okay, perfect. Put your eyebrows down. Rise them up. Puff out your cheeks. Smile. Frown. Perfect. Upon this, the patient was able to perform all of the commands, and they were bilaterally equal to both sides of her face. Therefore, cranial nerve number 7 is intact. Now we're going to move on to her eyes. Can you close your eyes for me? Okay, so just inspecting the patient's eyelids. There's no lesions, no scars, no redness or bruising present. Her eyebrows are symmetrical in position, and the distribution of her hairs are evenly. Her eyelashes as well, there's even distribution on both sides of her eyes of her eyelashes. Okay, you can just open up. I'm going to press down. You're just going to tell me if you feel any pain, okay?
No pain.
No pain. Upon inspecting the patient's eyes, her conjunctiva is pinky and it seems moist, and her sclera is white, and there are blood vessels present in both the inners and the outer corners. Now I'm going to test for cranial nerve number 3, which is ocular motor. You're just going to look straight ahead to me, okay?
Mm-hmm.
So both the patient's pupils are round and about 4 millimeters in diameter. And now I'm going to check for the constricting, both direct and consensually. Okay, upon direct light shining, the patient's pupils constrict. And while doing the consensual test, they also constrict. Now you're just going to follow the pen light with your eyes, okay?
Mm-hmm.
When doing the accommodation test, the patient's eyes converges inwards and the pupils both constrict. Therefore, patient's cranial nerve number 3, the ocular motor, is intact. Now we're going to move on to her ears. Upon inspection of the patient's ears, they seem bilaterally equal in position, and there is no visual redness or lumps or masses or lesions or scars on her ears. When looking inside the patient's ears. There's no excess discharge or drainage or cerumen seeping out of her ears. Moving on to her nose. Patient's nose is midline to her face. There is no abnormal flares of her nostrils as she inhales and exhales. There's also no discharge coming out or scars or lesions present on her nose. Moving on to her lips. The patient's lips are symmetrical and proportionate to the rest of her facial structure. Her lips are pinky and they are hydrated. There's no lesions on her lips either. Now I'm going to test for cranial nerve number 9, which is the glossopharyngeal nerve, and cranial nerve number 10, which is the vagus nerve. I'm just gonna put this tongue depressor on your tongue, and I'm gonna have you say "ah" for me, okay?
Okay.
Perfect, thank you. Once doing the test, both her soft palate and the uvula rised up, therefore cranial nerve number 9 and 10 are intact. Now you're gonna stick out your tongue for me and stick out your tongue. Perfect, move it side to side. Thank you, and repeat the words "like, tight, dynamite."
Like tight dynamite.
Thank you. Upon this, cranial nerve number 12, hypoglossal is intact because the patient's tongue was able to maintain midline and she was able to move it side to side, and also repeat the words "like, tight, dynamite" with no noticeable tremors. Now we're gonna move on to the neck. Upon looking at the patient's neck, there's no lesions or masses or scars present. There's no abnormal swelling either. It seems to be midline. The trachea seems to be midline. I'm going to palpate. Just let me know if you feel any pain, okay? No pain? Okay. There's no obvious enlargement of her thyroid gland, and her trachea is also midline. She felt no tenderness. The skin is warm to touch, and there was no abnormal colors or discolorations present. Now I'm going to assess her carotid arteries. Both sides seem regular rhythm and bilaterally equal, and they're at a 2+ bounding. Okay, now I'm going to assess for cranial nerve number 11, which is the spinal accessory nerve. I'm going to apply resistance to both sides of your face. You're just going to try to resist it, okay?
Mm-hmm.
Perfect. Okay, and now the same thing, just try to shrug your shoulders up. Perfect, thank you. Patient was able to resist force and moving her neck side to side and also shrugging her shoulders up. Therefore, cranial nerve number 11 is intact. Now we're going to move on to her upper extremities. And I'm going to start by inspecting her arms and her hands. Upon looking at her arms, there is even hair distribution on both arms. There is no visible lesions or masses or even joint pains around her elbows, her wrists, and her fingers. There's no discoloration, there's no redness, and the color is cohesive with her ethnical background. I'm going to palpate and you're going to let me know if you feel any pain, okay?
Okay. No pain.
Okay, no pain. There's no tenderness or superficial masses felt upon palpation, and her skin on her arms and her fingers were warm to touch. Now I'm going to assess the patient's radial pulse. Can you just take off your watch for me, please? This I would count for 30 seconds and then multiply it by 2. Okay, perfect. After 30 seconds, the beats per minute is of 80. It's bilaterally equal and it's bounding +2. Now I'm going to do the grip test. Can you just squeeze my hands as tight as you can? Perfect, thank you. Upon completing the grip test, the patient has strong grip of +5 and it's bilaterally equal in both her right and her left hand. Now we're going to inspect her lower extremities. I'm going to push this up. And take off the shoe. Perfect, thank you. Okay, upon inspection of her legs and her feet, there's even hair distribution on both legs. There's no visual lesions, masses, or scars on her legs or any edema present. With her toes, the same thing. They seem to be the same size, and there's no lesions on her toes or any discoloration or bruising. I'm going to palpate now and you just let me know if you're feeling pain, okay?
No pain.
Okay, patient reports no pain. There was no tenderness felt upon palpation or superficial masses also. Thank you. Now I'm going to get you to turn around and take off your shirt so we can do the thorax. Upon inspection of the patient's posterior thorax, there is no visible lesion or masses present, no moisture either. There's no redness or bruising. The color of her entire back is consistent with her ethnical background. The scapula are in the same place and bilaterally equal. There's no skeletal deformities of her spine. Now I'm going to check for her chest expansion. I'm just going to have you take a deep breath in for me and out. Thank you. Upon taking a deep breath in and a deep breath out, her chest expansions is bilaterally equal. Now I'm going to palpate and you're going to let me know if you feel any pain, okay?
Okay. No pain.
Okay, there's no pain. Upon palpation, I didn't feel any tenderness or superficial masses felt either, and her skin is warm to touch. Now I'm going to auscultate the patient's posterior chest. Every time you feel the stethoscope on your skin, can you please just take a deep breath in and out for me?
Yeah.
Perfect, thank you. You can put on your shirt. Upon auscultation of the patient's posterior chest, I heard no wheezing or crackling present. There were clear breath sounds, bilaterally equal throughout both sides. From T1 to T2, I could hear bronchovesticular sounds, and from T3 to T4, I can hear vesticular sounds. You can just turn around. Now I'm going to inspect the patient's breathing rate. At this moment, she wouldn't know that I was doing this. And I'm also going to test it for 30 seconds and then times it by 2. So you can just take regular breaths in and out for me, okay? Thank you. Upon assessing for 30 seconds, the patient has 20 breaths per minute. She did it effortlessly. There was no tugging of her trachea while she was breathing, and it didn't seem like she had any excess use of her accessory muscles while breathing, and there was no labored breathing. Now I'm going to assess her cardiovascular system, and I'm going to listen to her apical pulse, which is located by auscultating the mitral valve, which is located in the 5th intercostal space in the left submidclavicular line. Can you just lift your shirt for me, please? Mm-hmm. Just gonna lift over to the bell. Perfect, thank you. This would also be listened to for 30 seconds. Her beats per minute are regular in rate. She had 80 beats per minute. I could hear S1 and S2, but there was no presence of S3 and S4, resulting in no sounds of brewery or murmurs present. Now we're going to move on to the abdominal assessment. So can I just get you to lie down on the bed, please? Okay, I'm just going to lift this up. And I'm going to pull this down, okay? Okay, and upon inspection of the patient's abdomen, there is no unusual masses or lesions or scar present. I do see a little bit of striae along her lower quadrants. There's no unusual pulsations either. There's no redness and no discoloration, and the color is consistent with her ethnical background and the rest of her body. Now, if I look at the contour, her contour is flat, and then to assess for the umbilicus, I would look at the edge of the bed, and I'd see that her umbilicus is midline and inverted. Now I'm going to auscultate the patient's bowel sounds using my diaphragm, and I'm going to start at the lower right quadrant. And then the right upper quadrant, and then the left upper quadrant, and the left lower quadrant. Perfect. Upon auscultating the patient's abdomen, I could hear high-pitched gurgling sounds. The frequency is from 5 to 30 gurgles per minute, resulting in hyperactive bowel sounds. And now I'm going to palpate the patient's abdomen. Just let me know if you feel any pain, okay?
No pain.
No pain. Okay, patient report no pain upon palpation. I also didn't feel any distension, and her abdomen feels soft and non-tender. And that concludes my assessment. So I'm just gonna drape the patient. Okay, and you can just sit right back up. And that concludes my assessment.
Hello, my name is Becca. I'm going to be the nurse practitioner doing your assessment today. Can you tell me your name and date of birth?
Allison Harbinski, September 14th, 2002.
Perfect. So on general inspection, my patient is well appearing. She is in a good mood. She answers questions appropriately, and there's no obvious signs of trauma or skin breakdown or anything. So first, we are going to assess your head. On inspection, it is symmetrical. There is no lumps or bumps. There is no bruising or breakdown. I'm going to palpate your scalp and look for signs of alopecia. Do you have any pain or tenderness while I palpate?
No.
Perfect. And I feel no asymmetry, no lumps, no abnormal spots. Perfect. So we are going to test cranial nerve 5.
Okay.
So first, I'm going to palpate your temporals. Can you clench your jaw? Perfect. And now I'm going to palpate your master muscles. Can you clench your jaw again? Beautiful. So now we are going to test if you can differentiate between soft and sharp sensations. So you can close your eyes.
Okay.
And I'm going to poke various parts of your face and just let, sorry, it's okay. Just let me know if it is soft or sharp.
Okay.
Okay.
So,
We'll try that one again.
I didn't even feel it.
Okay, sorry.
Sharp.
Perfect.
Soft.
Okay, we're gonna start from the top, okay?
Okay. Sharp. Soft. Sharp. Soft.
Perfect.
Sharp. Soft. Sharp. Sharp.
Perfect. So now we're going to test cranial nerve 7, which is your facial nerve. You can open your eyes.
Okay.
Can you raise your eyebrows? Perfect. Can you smile? Can you frown? And then close your eyes for me and try to open against my resistance. Great. So next we're going to go into an eye exam. So on inspection, your eyes are symmetrical. There is no redness. Your sclera are white. I'm going to put on your eyelids. everything is looking pink and moist, and you're making tears appropriately, and all of your eyelashes are intact. So we are going to test the corneal light reflex, so look straight ahead, and I'm gonna shine this light and check for her. Perfect. So her eyes are symmetrical, there is no strabismus or nystagmus, her pupils react appropriately, there's brisk reactions. So we are going to go into a vision test. So I'm going to test distance, near, and peripheral vision. So for this one, I just have a pocket chart. So I'm going to stand 6 feet away, and you're going to read the smallest line that you can read for me.
LTFPH.
Perfect. And then can you close your left eye? Or just cover your left eye? And what's the smallest one you can read?
LTFPH.
Perfect. And switch to your right. What's the smallest one you can read?
GFDHJ.
Perfect. She has 20/20 vision. So now we are going to do it from 14 inches away to test your near vision. What's the smallest line you can read?
LTFPH.
Beautiful. And then we're going to test your peripheral vision. So I'm going to move my fingers out of your periphery, and you can tell me when you stop seeing.
Okay.
Right? Yeah. Perfect. So now I am going to use the ophthalmoscope and do a fundoscopic exam. You can just look straight ahead, and I'm going to look at your retina, your retinal vessels, your optic disc, and the red reflex. Sorry, it's just going to be a bright light.
That's okay.
Perfect. So the retina is intact. There is red reflex present. All of the retinal vessels are intact. The optic disc has distinct margins. Beautiful. Same on that side. Great. So now we are going to move into a nose exam. Okay. So again, upon inspection, her nose is symmetrical. There is no obvious signs of breakdown. There is no redness or swelling, no discharge noted. I'm going to palpate, so just let me know if you have any pain or tenderness.
Nope.
Perfect, and everything feels good. I'm going to also palpate your sinuses. So again, do you have any pain or tenderness?
Nope.
Perfect.
No.
Great. I'm going to look inside your nose, so just tilt your head back a little bit for me. I'm going to make sure that both sides are patent. Great. This side. Beautiful. So both sides are patent. There is no redness or discharge. The septum is not deviated on either side. So we are going to test your sense of smell, which is cranial nerve 1. You didn't see what that was. Close your eyes and then cover one side of your nose. And then what do you smell?
Alcohol pad.
Perfect. Now do the other side.
Alcohol pad.
Beautiful. Oh, it was air freshener.
Oh.
Now I'm going to look in your ears and do an ear exam. So on inspection again, her ears are symmetrical. There is no signs of discharge. They are similar in shape and position. So, sorry, I'm going to palpate your pinna. Do you have any tenderness?
Nope.
On your tragus?
Nope.
Beautiful. I'm going to look inside your ears. On an external exam, everything is looking great. There is no redness or discharge. Internal exam, I'm going to pull up and back. There is no redness or discharge in the auditory canal or at the tympanic membrane. It is pearly gray, concave, and intact. And on the other side, the external is symmetrical. There is no redness or discharge. And then on the internal side, beautiful, no redness or discharge. Tympanic membrane is concave, pearly gray, and intact. And there's no fluid on either side. So good. So now we are going to test the Ryan and Weber test, which tests hearing loss. So the Ryan test is a air to bone conduction test. So I'm first going to make a sound with the tuning fork, put it to your master bone, and then once you stop hearing the sound, I will move it to just next to your ear.
Okay.
And then you'll tell me when you stop hearing.
Okay.
It. Ready?
Mm-hmm. Now.
So here.
Mm-hmm. Now.
Perfect. I know it's a long one. Okay, on the other side, kind of the same thing. Just let me know when you stop hearing it. Beautiful. Now.
Now.
Perfect. I know it's a long one. Okay, on the other side, kind of the same thing. Just let me know when you stop hearing it. Beautiful. Now. Perfect. I know it's a long one. Okay, on the other side, kind of the same thing. Just let me know when you stop hearing it.
Now.
And this one in.
Mhm.
Beautiful. And then we're going to do the Weber test, which tests for bone conduction.
Okay.
So I'm going to make the same sound and then put it right in the middle of your forehead, and just let me know if you can hear it equally on both sides and then when it stops.
Okay.
Can you hear it equally?
Yes.
Right there. Just let me know when it stops. Sorry. Moving it.
Now.
Beautiful. So, no signs of hearing loss in either test.
Okay.
So next we are going to inspect the mouth and throat. So on inspection, her mouth is symmetrical, there is no drooping, her lips are intact, there is no cracking, they are pink, moist. Can you open your mouth for me? I'm just going to take a look inside. So her buccal membranes are moist and pink, her tongue is also moist and pink, her teeth are all intact, and then can you just stick your tongue out so I can see your throat? I'm going to use the tongue depressor. Okay, sorry. Perfect. So her throat is also pink and moist and intact. Her tonsils are not visible. There's no cobblestoning, and there is no signs of postnasal drip. So we are going to assess cranial nerve 11, which is the hypoglossal. So again, can you just open your mouth, move your tongue from side to side. Perfect. And then I'm going to grab your tongue, I'm sorry. And then move against my resistance. Perfect. On the other side. Beautiful. And then we're going to also test cranial nerve 10, which is the vagus nerve. Can you stick your tongue out and say ah? Perfect. The uvula is midline and the soft palate rises appropriately. And then cranial nerve 9 is the glossopharyngeal, and I'm going to test your gag reflex.
Okay.
I'm sorry. You can stick your tongue out. Ready? Good job. I know, it's no fun. So all of your cranial nerves are intact.
Lovely.
So next we're going to inspect your neck. Everything looks symmetrical. I'm going to palpate, make sure that, sorry. Make sure that your trachea is midline. Perfect. There is no lumps or bumps anywhere. I'm going to assess your carotid pulses. Beautiful. So there are 2+ on both sides. I'm going to, can you just turn to your side slightly? I'm going to assess the position of your thyroid. Does this hurt at all?
No.
Perfect. Beautiful. Okay, you can come back. That's all for the neck exam.
Okay.
I'm going to do a thoracic exam now. So first, on inspection, chest expansion is symmetrical. Patient is in no distress. She has a normal rate and rhythm. So I'm going to start off by percussing. There's 8 fields in the front that I'm going to percuss.
Okay.
Ready? I'm sorry. So any fields that are lung tissue are going to be resonant. Come down here, I'm sorry.
That's okay.
And now you can turn to the back, and I'm going to do the same on the back. So there's 10 spots on the back that I'm going to percuss. Again, anywhere that is lung field is going to be resonant, and then diaphragm will be dull. Beautiful. So next, you can actually stay turned that way. I'm going to check the diaphragmatic excursion. So I need you to let out a big exhale and then hold it, and I'm going to percuss and find where the dullest point is.
Okay.
Okay, ready? Perfect. So it was right here. So now you can take a big inhale, and then I'm going to do the same. Perfect. And then we're going to measure it, and it should be about 3 to 5 centimeters. You can breathe for a minute. Beautiful. Perfect. So while I have you this way, we're going to do some tactile affirmatives. So I want to hear the vibrations when you say 99.
Okay.
On the back, there is 4 spots that I'm going to palpate. So when you hear my, when you feel my hands move, just say 99.
Okay. 99. 99. 99. 99.
Perfect. On the front, you can put your back. There is 3.
99.
Sorry.
99.
Put that here.
99.
Beautiful. Lastly, we are going to listen, make sure that there's no adventitious breath sounds, everything sounds clear and equal. Sorry.
That's okay.
Perfect. We'll listen on the back as well. Perfect. So everything sounds symmetrical. Her lung sounds are clear. There is no wheezing, no rales, no rhonchi. Everything sounds great. So then lastly, we're going to go into a cardiac exam. So first, I am going to actually auscultate.
Okay.
So we're going to auscultate all of your heart sounds using the bell and the diaphragm.
Okay.
So first we have the aortic, which is the second intercostal on the right side. Pulmonic is the second intercostal on the left. Herb's point is the third on the left. The tricuspid valve is about the fourth. And we come down here for the fifth, and that's the mitral valve. And then we're going to switch to the bell, and the same mitral is the fifth. Tricuspid is the fifth. Third is the third. Second. And the aortic is the second on the right. And then I'm also going to palpate your cardiac pulses one more time, and then we're going to listen to them. So it's 2 plus on the left, 2 plus on the right. We're going to listen, make sure there's no worries. Beautiful. No worries or throws noted. So you can actually, I don't have a bed that's 30 degrees, so we'll do our best. You could just, let me put a second pillow to just try to help. We're going to assess jugular venous distension. So you can just lay back. Perfect. And measure. Oh, everything looks good. So you can actually stay laying back like this for the last half of our exam.
Okay.
So next I am going to assess your aortic, your abdominal aorta, your renal arteries, your iliac arteries, and your femoral arteries. So I'm going to just inspect first. Everything looks good. I'm going to also listen, make sure there's no noise. So first your abdominal aorta. Sorry, too many pillows. So we'll go to your renal arteries. And mostly your femoral arteries. Okay, everything sounds equal. There is no worries or thrills. Lastly, we will just palpate your peripheral pulses and check for a cap refill in all of your extremities. So go left and right, we'll check radials. So it's 2 plus pulses everywhere. Your cap refill is less than 2 seconds. And then your pedal pulses. These are hard ones to find.
Yep.
Perfect. So the 2 plus bilaterally, and then again, her cap refill is less than 2 seconds. So that concludes our exam. Do you have any questions?
Nope.
Beautiful. Everything was within normal limits. Thank you for being my patient.
No problem.
Thanks. Yay!